The broadcast is now starting. All attendees are in listen-only mode.
Hello, and thank you for your interest in learning more about the RWJF Culture of Health Prize for 2017. This Phase 1 application informational webinar is being recorded, and we will make this available to you in case you want to review the material again later or even share the presentation with your community partners. My name is Carrie Carroll, and I am coming to you from Madison at the University of Wisconsin Population Health Institute. Also presenting today, you're going to hear from Katie Mears with the Robert Wood Johnson Foundation, and in just a few minutes I'll turn things over to Katie to speak. We'd like to start by acknowledging that the RWJF Culture of Health Prize is a collaboration between the Robert Wood Johnson Foundation and the University of Wisconsin Population Health Institute. Many of you know the University of Wisconsin Population Health Institute from our work with leadership on the county health rankings and roadmaps over the past decade, and the Culture of Health Prize is an important initiative that was out of our work with RWJF on county health rankings and roadmaps. So we're partnering together and with others to help build a culture of health across the country. Next, we want to take just a moment to get you oriented to the technology we're using today. It may be new for some of you. This GoToWebinar attendee interface is made up of two parts on your screen. On the left, you'll see the viewer window, and this is the screen where you'll see the presentation throughout the 1 hour. And then on the right, you'll see the control panel, and this is where you can interact with us. If you're having any challenges with the technology, please let us know through the control panel. And thanks to many of you who submitted questions when registering for this webinar. We hope to address your questions along the way. And you may also type additional questions you have throughout the session, and my colleague Olivia Little will respond, or we'll do our best to address some of those questions later in this session. The slides for this webinar are available in the handout section of this control panel, again on the right-hand side here. You'll also see two very key documents. You'll see the 2017 call for applications and the frequently asked questions document, which is extremely helpful for applicants as it answers actual questions we receive from community members throughout the year. And we encourage you to review the FAQs, the frequently asked questions, very carefully as you prepare your application. So let's move toward the content of today's session. We are going to start off with an overview of RWJF's vision to build a culture of health throughout the United States. Next, we'll cover the purpose of the prize and ensure that you're aware of the past winners. And then we'll really spend the bulk of our time together talking about the application and the selection process. And again, having time for questions and answers at the end. So at this point, I'm going to turn it over to Katie Mears with RWJF to tell us more about the Foundation's vision. Katie?
Thanks, Carrie. Our vision of America is one where we strive together to build a national culture of health, a culture that enables all in our diverse society to lead healthier lives now and for generations to come. We know that health is greatly influenced by where we live, how we work, the safety of our communities, and the strength and connectivity of our families and communities, not just by what happens in the doctor's office. In order to build a culture of health, we need new leaders and partners from across disciplines and across sectors to come together to think of health and think about change in new ways. As expressed by our President and CEO, Dr. Risa Lavizza-More, our goal is to weave these many threads of health into richly textured fabric we call American life. We know that these communities are already doing this. The prize is about recognizing those communities at the forefront of improving health, those that are thinking about the many threads of health and that are creating new partnerships and collaborations and are weaving it all together across the community. This is an enormous opportunity in engaging with these communities, learning from what they have done, putting their stories up to inspire others who can learn from them and be instructed by their experiences and their lessons. With that said, the purpose of the prize is really to honor and elevate communities that have placed a priority on health and are creating powerful partnerships and deep commitments that will enable everyone, especially those facing the greatest challenges, with the opportunity to live well. For us, the communities that have won the prize and will win the prize are emblematic of our vision of a culture of health in action, and we cherish and are excited about that there is no one way to build a culture of health. The prize is an opportunity to represent and to recognize all types of places, urban, rural, tribal, large cities, counties, small towns, and everything in between. Communities that are committed to not only providing access to high-quality care, but also providing opportunities for better health by transforming neighborhoods, schools, and businesses so that good health flourishes everywhere. We have received several questions about whether there is a population size minimum or maximum to apply for the prize, and there is not. We have had extremely competitive applications from communities that span the full range of population size, which you can see from looking at our winners. It's important to emphasize that the prize is not a grant. It is an award to recognize communities for what they have already accomplished on their journey to build a culture of health. Therefore, communities can use the $25,000 in any way they choose to enhance their work. Budget reports to RWJF are not required. The purpose of the prize goes far beyond the dollar amount, however. It is the honor and an opportunity to recognize and elevate the work being accomplished in communities across the nation. Prize winners have their stories and successes celebrated broadly to inspire others towards locally driven change. They engage with other national and community leaders as ambassadors for building a culture of health across the nation, and are provided with video, communications, and other supports along the way. They also become a part of the national network to engage and learn from other prize winners, to network locally, regionally, and nationally. So while the work will continue within your communities, there is a deep desire from other communities around the nation to hear about and learn from what you are doing. For us, it is also an opportunity to connect you with each other and with your peers in other communities to foster that learning and networking. We have also heard from past prize applicants that the process of applying can be a great learning experience for your community. Applicants often report that they benefit from the process by bringing partners together, reflecting on what the community has accomplished, and using the prize criteria to identify strengths and opportunities. As one applicant shared with us, the introspection involved in writing the application served as a significant motivator for us. When we saw on paper how much we were actually accomplished, it invigorated us to forge forward. We now have 27 designated communities as RWJF Culture of Health Prize winners. Congratulations to our 2016 winning communities who were just announced on September 14th. They are represented by the orange dots here, and our past winners are shown in blue. You can see that our winners span 19 states, including 4 tribes, and represent communities of many different sizes and geographic characteristics. With all of that said about the context of the prize, I'll turn it back over to Carrie, who will go into the actual application process.
Thank you so much, Katie. You can read all about those winning communities that Katie mentioned and view their videos and even start the application process on the prize website, which is on the screen here, rwjf.org/prize. And again, the call for applications and the frequently asked questions are also on that same website. So in a few minutes, we'll share a few screenshots of the website so you can better know precisely where to find these important documents. And this will also be helpful for those of you that are listening to a recorded version of this webinar. So I'm sure all of this has whet your appetite for learning more about what you can do to bring your community to the forefront as a potential RWJF Culture of Health Prize winner in 2017. So let me do a brief overview and then we'll dig into a little more detail on the application process. There are 3 phases to the prize application process, and right now we are in phase 1, which includes a very brief 5-page essay that introduces the reviewers to your community and to your key accomplishments. Often people want to know about how many applications we receive for phase 1, and it really does range from 200 to 350 per year. The next step then, phase 2, will invite 50 communities, about 50 communities, to proceed on to phase 2. And then from those 50 communities, we'll select up to 16 finalists who will receive site visits. And then following the site visits, up to 10 communities will be selected to win the RWJF Culture of Health Prize in 2017. So just a quick overview of the timeline. Again, the phase 1 deadline is November 3rd. That is a Thursday. And what we really want to emphasize today is that there is a time on that day. It is 3 p.m. Eastern Time. So please mark your calendar and know that that deadline, that 3 p.m. Eastern Time, is absolute and there are no exceptions. And then here is the overall timeline for the call for which is also detailed in the call for applications. Just 2 other dates I want to call out right now. Those that do apply for phase 1 will hear from the prize team on December 9th as to whether or not they'll be invited to submit a phase 2 application. And then phase 2 applications are due in January 20th. So at this point, you might be seeking more information about who's eligible to apply for the prize. This is one of the biggest questions that were asked, or most frequent questions. This prize is very different from other prizes because it is based on the place. So it is not a prize for a particular organization or a particular accomplishment in your community. The prize reflects the work across the whole geography of your place. So to be eligible, you must present an application that reflects the work of a town, a village, a borough, or other local incorporated place, a city, a county or parish, a federally recognized tribe, a Native Hawaiian organization serving and representing the interests of Native Hawaiians in Hawaii, or a region that would be contiguous towns, cities, boroughs, or counties, those that are working together in an integrated way. And communities within U.S. territories are also welcome to apply. So clearly, one of the things you don't see highlighted in this list is neighborhoods. We understand that in larger cities, especially, it may be difficult to represent the work of the whole city, but we really ask you to please strive to do this. We cannot look at a neighborhood alone. It's perfectly acceptable within the context of a city or a county-wide application to feature the good work of a neighborhood, but please do so, again, in the context of the broader efforts that are taking place within that town or city or county, for example. So as we've said, the prize honors the work of whole U.S. communities. We often see organizations or coalitions taking the lead in preparing the application for consideration, and we know someone in that community has to be the author, that leader, that convener. But again, please remember this is a place-based prize award for whole communities. So to be competitive, it is absolutely imperative that prize applicants keep a community-wide focus in mind as they're working on their application. We've also received some other questions pertaining to eligibility. We've been asked, what is the most common mistake that voids entries? And part of the reason I'm emphasizing the whole community so clearly is that this is one of the most common mistakes, that an organization submits an application and it really doesn't reflect the whole community perspective. Often the application really just talks about the work of a single organization or a single program. Another question in regard to eligibility that we have received is, can communities located in the same state as a previous prize winner still apply? And as you think about the map that Katie shared, you will see that there is precedence that absolutely yes. Each application is judged individually and not in relationship to other applicants or past winners located in the same state. I also want to be clear that past applicants may also apply again this year. There's an exception to this in that past prize winning communities and communities that were designated as finalists just last year in the 2016 competition, we asked that they sit out for 1 year before they reapply. So if you didn't receive a site visit last year, or excuse me, earlier in 2016, your community is not already a prize winner, then you're absolutely welcome to apply. And always ask us if you have any questions. We are here to help. So now we will turn to the heart of the prize competition, to the 6 criteria by which all prize applications are judged. This is really the most important part of how we select who goes on to be a prize winner, is really how your community performs across the 6 criteria. So Katie and I are going to tag team on the 6 criteria, and again, this is clearly the most important part of this presentation. We have received several questions about how these criteria are weighted during the selection process, and we want you to know there's no formal weighting of the different criteria. We are looking for communities that are able to address all 6 and in a very broad and holistic way. That said, the Phase 1 application process does pay close attention to the first 3 criteria. We consider the first 3 as foundational to building a culture of health. So the first criterion, defining health in the broadest possible terms. Building a culture of health means we use diverse strategies to address the multiple factors that influence health. And to depict this, we want to turn to the County Health Rankings picture of health on the next slide. When we talk about defining health in the broadest possible way, we're thinking about health factors that you see, for example, in the blue boxes on the right. These ultimately, on the right. These ultimately drive how long and how well people live. So we're looking to understand how you and your community are bringing this model to life in ways that demonstrate responsiveness to your community's needs, assets, and priorities. And we're really looking for you to describe how you are taking action across these areas. In particular, given the importance of social and economic factors, we're interested in hearing how your community is moving beyond targeting programs to populations in need, and instead really taking specific action around the social and economic factors, such as improving high school graduation rates, early childhood education, job training, community safety. So we're looking for how your community is addressing health, again, from this very, very broad point of view. Another question we often get is, what are some of the reasons applicants are disqualified or not chosen? As well as, what are you looking for in a successful application? Applications that focus entirely on clinical care and or health behaviors do not tend to be as competitive in the prize application process. This is really a very common reason that Phase 1 applications don't move forward. While work within these factors is certainly highly valued, judges, again, are looking for how applications exemplify a balanced portfolio of activities across the health factors and are clearly addressing social and economic factors to improve health. I will turn it over to Katie now to talk about criteria number 2.
Thanks, Carrie. Our second criteria is committing to sustainable systems changes and policy-oriented long-term solutions. For us, this is making thoughtful, deliberate, data-informed policy, programmatic, environmental, and systems changes that ensure that sustained impact of those changes over time. Changes that don't go away if the grant ends or the program ends. We really encourage applicants to demonstrate how organizations across different sectors are creating a common agenda for change, how that agenda is informed by and identified priorities, and how they are taking coordinated, strategic, aligned actions to solve the challenges that is facing their communities. We know no health issue can be solved with a silver bullet, so we are looking for how communities are pulling together strategies that improve health and how those strategies go beyond just programs and services to think about sustainability over time. This involves making lasting changes to policies, systems, and environments, sometimes at the level of government, but also at the organizational level, for example, within businesses, workplaces, or schools. As stated aptly by one of our recent prize winners, we're not going to affect change that really does move the needle on the health of a community without policy change. We received a question asking for examples of policy, systems, and environmental changes that communities have undertaken. There are many, but some examples include passing tobacco policies, food ordinances, housing and construction, physical environment improvements such as sidewalks and trail systems, and education and job policies that promote growth and economic security.
All right, criteria number 3 is about cultivating a shared and deeply held belief in the importance of equal opportunity for health. So building a culture of health means all individuals feel they have a voice and a role to play in improving the health of their community. This includes a shared commitment to identifying gaps in opportunities that tend to lead to disproportionality and negatively affect certain populations. So we're asking communities to demonstrate how their efforts are leading to a community where all people feel a sense of security, belonging, and trust, and to show how collective problem solving and diverse perspectives, including full participation by those most affected by health and by poor health outcomes, are helping to drive solutions. So just to emphasize this third very important criterion a bit further, we're looking for efforts that go beyond targeting people and populations that are experiencing negative health outcomes to really authentically engaging community members to create change. This means engaging diverse perspectives and truly valuing the voice of residents at all levels of the community. We really want to see how people who are most affected by poor health outcomes are being included in the problem solving collectively as full participants in identifying problems and implementing solutions. So rich engagement of all people in the community to create and implement solutions that will improve health. When you take a look at the stories of our prize-winning communities, you'll read about some great examples of community organizing, mobilizing youth and student leaders, and engaging community residents around issues such as violence, revitalizing neighborhoods, and improving education. These are just some of the ways that prize communities have told us they're working to engage the entire community. Katie?
So As Carrie mentioned, the first three criteria are the main focus of the Phase 1 application. However, we are also looking for standout work in the next three criteria, and more information will be gathered about these criteria as applicants move to the Phase 2 of the competition. So criteria 4 is about harnessing the collective power of leaders, partners, and community members. It builds on the notion of engaging the community and goes beyond that to recognize that building a culture of health means that we are all in this together. And we are fully leveraging how the many partners in the community can come together around the common agenda of building a culture of health. We encourage applicants to demonstrate how those diverse organizations and partners are working together, how business, government, residents, nonprofit organizations, faith-based institutions are all collaborating together to develop the infrastructure and strategies for coordination, for moving forward coordinated action, and continuously communicating about their health improvement work. How community leaders are getting out of their silos and collaborating with other sectors, especially those non-traditional health partners, such as community businesses, community developers, or educators. We also encourage applicants to demonstrate a real commitment to developing community leaders. The notion that leadership goes beyond those that have positional power, so thinking about the leadership coming from different parts of the community and to foster that type of collective action and authentic civic engagement. Another thing I would emphasize here is that we are not interested in seeing the applicants from a single organization. We know there is a lot of dynamic organizations doing a lot of wonderful work. This is not an opportunity to highlight that, but to showcase how multiple organizations, agencies, and partners within a community are coming together to drive change.
Great. The fifth criterion is securing and making the most of available resources. So this means thinking with a real enterprising spirit. We want people to think about how they're using the assets of their community in the best way, how they're minimizing waste and maximizing value. We want to hear about how you're leveraging existing assets in the community. We often tell people this is not about who the best grant writer is. It is about looking at what you have in your community and using your existing assets. So thinking broadly about your assets, your people, your financial resources, your natural resources. How are you producing the best value for health? We want to hear how you're creatively approaching the generation, the allocation, the alignment, and the mobilization of diverse financial and non-financial resources to really evolve and sustain your health improvement efforts. Sustainability is a really critical piece here, and this is partly why we're not interested in seeing or hearing just about how many grants you've been able to secure, but really what we want to hear is how you've received a grant and how you've fully integrated that work into your community's efforts, how you've been able to sustain that work, and certainly beyond the completion of the grant period. And I'll turn it back to Katie for the final criterion.
Great. So this is our last criteria, measuring and sharing progress and results. For us, building a culture of health means thinking and working with that destination in mind. It means having a commitment to quality and impact, both on how the work is done and what impact is achieved. This involves several elements that we would like to see in the application. So how communities are establishing shared priorities and then agreeing on definitions of success and identifying specific goals. Also how data is being used to set those priorities and track progress towards those goals. And finally, what information is being used to signal when programs and strategies need to change course because progress is not being made in the way that it might have been expected. We also want to see how communities are sharing data and sharing their outcomes and how they communicate and celebrate the successes along the way as they work towards better health outcomes. So registrants asked several questions about what types of data and outcome measures should be submitted in an application. In phase one, we suggest starting by focusing on your data goals, the identified priorities and success measures your community has identified, and what you're doing to collect that data and measure outcomes. You can certainly highlight both quantitative and qualitative data that speaks to your goals, but in phase one, given the space limitations, you may want to focus on a few pearls of outcome measures if you have them, and the second phase of the application provides more of an opportunity to report outcomes in depth. So now I'm going to turn it back over to Carrie, who's going to go into the specifics on how to apply. Carrie.
All right. So as I mentioned earlier, everything you need to apply for the prize is available at RWJF/prize. So when you go to this homepage, you'll see the announcement of the most recent prize winners that Katie mentioned. We announced last week. Below the announcement, when you scroll down, you'll see a link, 2017 call for applications. So that's where you go to get more information about the application process. That will take you to this page pictured here, which is also, again, where the prize criteria is listed. And when you're ready to start really looking at the application materials and get in there and start putting your application together, you click on Apply Now, and then that will take you to what's called the Funding Opportunity page. So you'll land on this page on the RWJF website, and this will provide you with even further information. You'll see here on the right-hand column, or on the screen, it'll say Key Materials, and it's a hyperlink to the documents we've talked about today. The call for applications is also referred to as the Funding Opportunity Brochure. So if you click on that, you'll be able to download a PDF, and you can print that out on your own computer. And you'll also see that there's a version in Spanish. So as we mentioned earlier, really encourage you to take a look at the FAQ document, the frequently asked questions, and you can also download that in the same section. And then finally, we want to be sure that you notice that Apply Online button. So that's where you click to go to the My RWJF portal. And we'll send out some of these materials later today as well. So just know that. And then finally, in terms of a screenshot, this is where you'll work on your application. So if you have ever applied to the RWJF Foundation before, you can re-enter your email address and password here, and then it will recognize you. There's also a place to click if you've forgotten your password, and then they'll supply that to you. If it's the first time you're making an application to RWJF, then you'll need to register. So just click on the register button, and it will take you through that process. So when you go to myrwjf.org, it's going to have a number of different screens that will ask for various information, and we're going to walk through all of those right now. Note that once you've registered, you can download another document. It's a PDF. It's called Instructions for Applicant Communities, and that will be in the reference section on the left-hand side of the application homepage in myrwjf.org. So that provides some additional detail on some of these instructions here, specifically how to enter your data into myrwjf.org. We had a few questions before the webinar that asked if anything had changed from last year's application process, and it's really quite similar to last year in a number of ways. We've updated some of the language in the prize criteria, although, so as always, take a very close look at the prize criteria, the extended language written about those key principles, and we really encourage you to look at those in the call for applications very, very closely. For the phase 1 application, as I mentioned, the meat of it is a 5-page essay. It has two sections. First, you'll describe your community, and then you'll talk about 4 key accomplishments that your community has realized. So it's also important to know, we'll ask you for a little bit of demographic information, and for 2 key contacts from your community. Ideally, these 2 key contacts will be from different organizations who are partnering. These are the people that we'll communicate with throughout the process of the application, and they're sort of the key to the RWJF and at the Population Health Institute. So back to the essay. On the first page, we ask you to introduce your community. And so tell us a little bit about the key physical, social, economic characteristics of your community. Be sure to mention any important historical or cultural considerations. Really emphasize your assets, your pressing needs, how you got started on your journey toward building a culture of health and improving health in your community. Please try to make your community come alive to us. In regard to the 4 accomplishments, those will be, the majority of your 5-page essay will be on these accomplishments. So we get a lot of questions about what constitutes an accomplishment. So they're thought of as specific policies, programs, or strategies that you've deployed in your community, those that best respond to the identified needs of your community, and those that really demonstrate how you're making progress toward better health. We know there's a lot of great work going on across your community, and there's really not a lot of guidance we can provide in terms of how to best choose just 4. But we really want you to think about which 4 accomplishments reflect the 6 criteria that Katie and I just discussed. We know it can be challenging to narrow it down to 4, but I think if you really think about those 6 criteria and which of your accomplishments reflect those best, I think that'll go a long, long way. Accomplishments may be relatively new or well-established policies, programs, or strategies. Applicants often ask us whether an accomplishment needs to be a specific strategy or whether it can be a group of strategies, and it can be either. For example, many communities describe a suite of activities they're doing to address a pressing need. And we know most communities in this nation are struggling with obesity, for example. So many communities will feature one accomplishment as a set of closely related programs, policies, and strategies that they've employed in their community to address one pressing problem. Again, obesity is just an example. Accomplishments clearly need to be action-oriented and moving forward. They may not be a planning or a convening process, or simply the development of a coalition or a particular project. Accomplishments may not be your community health assessment or your community health improvement plan. We know this is all really important work. We know the importance of creating coalitions and bringing people together to do this kind of planning. We know it's labor intensive, but these are all really thought of as predecessors for your accomplishments. They're foundational. They're pieces that you build on, and your accomplishments further that work. So we want to hear about the things in your we want to hear about your accomplishments. We want to know what actually happened as a result of a coalition coming together, for example, or a community assessment plan being developed. Focus on results. When people ask why their application did not move forward, another common reason can be that the community may not have provided 4 accomplishments that meet the eligibility criteria. So again, please do not include simply the development of a coalition or your community health assessment plan as one of your accomplishments. After you've completed your essay, there's a very short worksheet. It's kind of an abstract of the information that you've shared in your application so far. So on this worksheet, we ask that you provide an accomplishment name, or the 4 accomplishment names, a brief description of which, and then indicate which of the health factors that we saw in the county health rankings picture of health that best describe that accomplishment. And then it's also helpful to note when the accomplishment began, which year. So brief summary as well as further detail in your essay, but a brief summary provided on this worksheet of your accomplishments is great. Phase 2 evaluation. So you really need to look for a way to describe your community and your 4 accomplishments to living out the 6 prize criteria. So in the first phase, judges look at applications. As they're looking at applications, they're looking at those criteria, and they're particularly honing in on the first 3, as we mentioned, in this first phase. So we like to be very transparent about this and let you know that we will very clearly be looking at how you're defining health in the broadest possible terms, how you're committing to sustainable systems changes and policy-oriented long-term solutions, and how you're cultivating a shared and deeply held belief in the importance of equal opportunity for health. The Phase 1 essay is evaluated by a range of reviewers from the University of Wisconsin Population Health Institute, as well as colleagues at RWJF, and also other partner organizations. So each application receives multiple reviews. So for Phase 2, just real quickly, for those of you that are invited to move on to Phase 2, there will be an opportunity to further expand the work of your community. There will be a second brief essay where you can present a more full picture of your health improvement process, and also where you'll be able to describe some of the accomplishments that you didn't get to hit on in Phase 1. We'll also ask you to respond to some specific questions to better understand how your community is working on all 6 criteria. And then also, for those of you that will advance to Phase 2, there is a brief video that provides judges with an opportunity to better understand your community in a different format and hear directly from community members. So those are a really important part of the Phase 2 application process, and should you advance, we know a lot of folks have questions about that video component, so certainly we will support you in terms of providing you with access to some online resources and some tools to produce a video, and some ideas for how to tap the resources of your community to do that. But it's really not a big production. We don't look for communities to submit professionally done videos. It's really more about how you tell us more about your community. And we also like to be sure it's super clear that the videos on the RWJF website, the videos that we've alluded to earlier, the videos of prize winners are not the same as those submitted by communities. Those videos that you'll see on rwjf.org are very professionally, highly professionally done, and those are done after the winners are selected. The last thing we will ask you to do for those advancing to Phase 2 is prepare a draft site visit itinerary. And so that's a document that helps us to get a better sense of what judges might see if they were to visit your community, who they might meet, and a better sense of your partnerships as well. So again, these are only things, pieces that are, or steps that are for those advancing to phase 2, but we just want to give you a little bit more information around that, and so as folks think about the entire competition. We've been asked if there is any advantage or disadvantage for past applicants to reapply. And as you think about reapplying, we just ask you to revisit the 6 criteria, think about the process, and think about your community, and have discussions with your partners. Do you feel you've made the progress that you want to see, and can you address the criteria perhaps more comprehensively than you may have in the past? If so, we certainly welcome your application. We absolutely understand that this is a continuous journey, and we welcome hearing how you are progressing in your journey in your community. So there certainly is no disadvantage to reapplying. For any community that has been a finalist in a past prize competition, if you advance to phase 2, this year, you will be asked to incorporate some additional information around your continued efforts and accomplishments to demonstrate movement and tangible progress to building a culture of health. So again, that's for past finalists. And if you don't know if your community is a past finalist, there is a list of them in the frequently asked questions document that we mentioned. So important to take a close look at the 27 prize-winning communities that Katie alluded to earlier in that map, and also look to be sure you know if your community has been a past prize finalist. So the last phase is the site visit phase, and I won't say a whole lot about this today, but this really is for up to 16 communities that are asked to move forward, and it's really where communities can give more life and voice to phase 2. So what that looks like is about 4 to 6 visitors from RWJF, the University of Wisconsin, other national health experts come and spend about 24 hours in a community, and they take a tour, they have meals with community members, and really get a sense for progress in your culture of health improvement journey. And then finalist status is something that is publicly recognized, so it's a nice way to receive a little bit of spotlight for your successes. A question we get is, can any community win? So absolutely yes, any community can win. You'll see from our past winners that very large communities win, very small communities win. We have tribal communities that have won the prize, urban, rural, suburban. So this process really is about helping us understand how you're working to create a healthier place to live, learn, work, and play, and really connecting to the 6 prize criteria. People ask often what makes a successful application, and really is no one answer. We are looking for unique approaches. We're looking for you to tell us your community's individual story about how you're bringing the 6 prize criteria to life. So absolutely place matters, and it's context specific. Others have asked us for specific examples of how communities are building a culture of health. And for this, again, we really encourage you to check out rwjf.org/prize, the website, and take a look at the videos and stories of past prize winners and learn from them. We're really looking to see the range of work and how winning communities are bringing people together to address unique needs, and the different types of, and all different types of communities can become prize winners. So this brings us to the formal conclusion of, or the conclusion of the formal presentation, we keep this screen up here. It's to contact us here at the University of Wisconsin if you have any questions whatsoever. Please do not hesitate to email or call. A reminder about the handouts, and we have plenty of time for questions and answers. So Olivia, would you like to share any questions and answer them, or pass one to Katie or myself?
Yes, thanks, Carrie. Hi, everyone. This is Olivia over at the Population Health Institute. And we've got a couple questions here that I thought would be helpful for everyone to hear. A couple questions about what kinds of organizations can take the lead in applying for the prize. And so just to be clear on that, it can be any kind of organization. It doesn't have to be a government entity necessarily. We have a question about what kinds of organizations tend to take the lead on the application. And so we have seen, public health departments, mayor's offices, hospitals, schools, education departments, nonprofits, community development organizations. So it can be any community. I think the important thing to always keep in mind is that you're applying to recognize your whole community. And so you want to feature how the work goes beyond any one organization that's serving as the lead contact to show the broad work of all the partners that you work with. Katie or Carrie, would you add anything?
I think that's great. Katie, do you have anything to add?
Perfect.
And this might speak to another question that we just got about how do you demonstrate that you are entitled to apply on behalf of a community? I think I would say similarly that the very competitive applications that we get and the prize winners demonstrate that they are really working together across sectors and with many partners and showing how the whole community together is working to build a culture of health. So, if you demonstrate in your application that communication exists and those partnerships are strongly rooted and ongoing and working together, I think that's what we're looking for. Anyone want to add anything to that?
I don't have anything to add. This is Carrie. I know sometimes people are asking, what's the ideal number or of partners, or minimum number of partners to include. And again, there's really not any one answer. It's really important to think about the quality of your partnerships, I would say, more than the number of partners, and really, how to tell us, your story in your community and really what makes that authentic. So,
all right, we're getting lots more questions kind of rolling in here. I was wondering if highlighted accomplishments that are in progress can be highlighted, or if they should already be completed for all accomplishments. And I think, as Carrie mentioned, they can be either in progress or completed, and we are looking to sort of honor communities for what they're already doing. So we're not looking to fund a project, but to recognize, we know that it's a journey and things are ongoing, and so not everything is going to be, you're never fully finished. But I think it's some of both. And also a question about whether, if you're still forming those partnerships that you need, could you be eligible to apply? And I think one of the questions we've received in the past is, how do you know that you're ready? Your community is ready to apply. And so I think that's one thing, is to look at the criteria and say, can we demonstrate these already, or are we still getting there? And as Carrie mentioned as well, we don't consider a planning process or a convening process or forming a coalition as an official accomplishment. And so if you are still sort of going through that process, you may want to wait until you have some results from forming those partnerships that you can point to. So again, think about the results and what you can highlight as what you've done. Anyone want to add to that?
The prize, just again, just can't say it enough. It is an award for what communities have accomplished. It is, as Katie said, not a grant. So really just thinking about your journey toward building a culture of health. If you feel you've made significant progress and can speak to the criteria and are really working across those health factors, then that's a pretty good indication that you may be ready to apply.
Another question, must each accomplishment encompass all 6 criteria? You want to take that? You want me to take it?
Yeah, this is Carrie. I would say no. It is really fascinating to see how communities are evolving their culture of health and how the criteria sort of weave together at times. So it is true, sometimes accomplishments do speak to multiple criteria, but it's certainly not a requirement. Katie, is there anything you'd like to add on that one?
No, I think that you demonstrated that perfectly. In many cases, we see accomplishments reflect multiple criteria, but in no way is every accomplishment have to cover all 6. So just echoing Carrie.
Mm-hmm.
That's a great question.
Oh, there's lots of questions here, and I'll keep throwing them out, but please know that if we don't get to your question, you can always email us or call at the contact information on your screen right now. There's a question about, can 3 counties be included for one application for an isolated community? We define a region as contiguous towns, cities, or counties. And so if you are all connected physically and you work together, then yes, you can apply as a region.
Absolutely.
And again, I just want to highlight that we had some regional winners in 2016, and so please, go online and check out their stories to get an idea of some of the work that's happening regionally.
Time for a couple more questions, it looks like.
Sure. Who are the reviewers and how do you select them? Do you want to give a quick?
Sure. This is Carrie. The reviewers are actually listed on in the frequently asked questions document that I have stressed today a few times. So they are very much national health experts from across a myriad of sectors. So we have folks that are from the community development sector, from public health, from government, those that really have the lens on how communities are working to improve health. So we work very hard to ensure that group is diverse and that the perspectives are as broad as the health factors we're asking you to speak to. So also have some philanthropic members on there, some folks with an eye toward the business community, so really a diverse group. So it's a good question. They volunteer their time. They're really a great group.
I'll try to answer a couple more of these quickly, I think. Can we apply as multiple community collaboratives that are addressing the areas of health in our community? Again, I think it's important for us to see that multiple partners and collaboratives are working together, and those contacts on your application are just those people who will be fielding, the back and forth with our team on the application and receiving notifications. So it's more important what you feature in your application than who you designate as the person or organization to serve as that lead contact. And can we refer to specific online program information in the essay? So I think that refers to, can you include some links or some resources in your essay? I would say we don't review supplemental materials. So you cannot submit any supplemental reports or anything with your essay. It's really meant to be a kind of just a look into what you're doing, and we'll get more information as you progress in the competition. If you refer to a website, you can certainly link to something in your application, but I wouldn't just know that a reviewer may or may not go to that that website, so I wouldn't, base the substance of what you're trying to say, on a link or something like that. Lots of great questions. Again, look at our FAQ. Some of these questions are in there, and email us at prize@match.wisc.edu or call 608-263-6983 if you have further questions, and I'll turn it to Carrie.
As you can tell, Livia Little is a wealth of information, so again, please don't hesitate to reach out to us. I thank Katie Mears for helping to deliver this information today, and we look forward to reading your Phase 1 RWJF Culture of Health Prize applications for 2017. Thank you all very much. Be well.